So welcome everyone to our webinar this evening. My name is Katie. I'll be the host for our webinar. The title is All the Medication Tips Your Doctor Didn't Have Time to Tell You. There is a number at the bottom of the screen. Should you have any technical difficulties during the broadcast, you can call Citrix Support. The phone number is 1-800-263-6317. Our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions, so we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, but please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. Our webinar leader this evening is Nanette Savell. Nanette is a pharmacist who left retail and became a certified diabetes care and education specialist. She's been with Cecilia Health for 6 years. In the summer, she volunteers at a diabetes camp for kids. She loves watching movies with her husband of 28 years. In addition, she enjoys quilting, spending time outside gardening, as well as bird watching. So thank you so much, Nanette, for being with us this evening and sharing with us your knowledge and expertise. So you may take it away.
Thank you, Katie. Hello, everyone. And tonight I'm going to go over all oral medications, injections that are not insulin, and insulin. I'm going to review how and where these drugs work in the body, the recommended dosing, any advantages in addition to blood sugar benefits, the most common side effects, cautions or warnings. I'll also discuss how much of a decrease in the A1C you can expect at the maximum dose. Many of the medications I'll be discussing also come in a combination form, meaning one pill containing 2 or more different diabetes medications. However, I'll only be covering the individual medications this evening. Finally, we'll be briefly discussing tips on medication adherence. Now, before I begin, I want to talk about all the TV commercials you've seen for diabetes medications that are talking about decreasing the chance of heart attack, stroke, or congestive heart failure. The reason you're seeing these claims is because in 2008, the Food and Drug Administration mandated that all manufacturers of all diabetes medications were to conduct research to ensure these drugs would not increase the risk of heart attack or stroke. What's been proven so far is that none of the drugs increase the risk for heart attack or stroke, and in some facts, some of them reduce the risk. And that's why they're advertising that additional benefit. Now, I'll mention which drugs these include as we discuss them tonight. So there's many types of medications to manage type 2 diabetes, and these include oral medications, injections that are not insulin, and insulin. I'm going to start off with oral medications, and this is a list of fancy names that represent all the different drug classes of oral diabetes medications. Each of these drug classes work differently from one another with regards of how they lower blood sugars, and within each drug class there can be multiple brand names and generic names, so it's definitely confusing. Hopefully this presentation will help clear some of this up. The different drug classes of oral diabetes medications include biguanides, sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors, thiazolidinediones or TZDs, glucosidase inhibitors, meglitinides, dopamine receptor agonists, and bile acid sequestrants, and we have one glucagon-like peptide 1 GLP-1 receptor agonist that is a pill. So first I'm going to talk about metformin. It's part of the biguanide drug class, and the brand names included was Glucophage, Glumetza, and Fortamet. Now, metformin was approved in 1994 by the FDA, and it's become the most frequently prescribed medication for type 2 diabetes. Metformin works mainly on the liver. It's said that the average person with type 2 diabetes has 3 times the normal amount of glucose released by the liver. Metformin helps to cut down the amount of sugar that the liver releases. It also helps the muscles use some of the sugar from the blood, which also helps lower your blood sugar. Its recommended dose for starting on metformin is 500 milligrams once a day, and you should increase that over time to a maximum of 1,000 milligrams twice a day. Now, this is recommended to be taken with the last bite of food, morning meal, and evening meal. And the reason it's recommended to take it with food is to prevent the most common side effect, which is stomach upset. If you take it with food and you still have stomach upset, talk to your provider. They can switch you to the extended release tablets. The extended release tablets should still be taken with the last bite of food in the evening, but since it dissolves at a slower rate, you usually don't have any stomach upset. And there's multiple advantages to metformin. First, it's inexpensive. I always love that. It doesn't cause weight gain, and it doesn't cause hypoglycemia, low blood sugar. Additional benefit of this medication is it can decrease cholesterol. Research has also shown that metformin may have the potential to decrease the risk of heart disease. Now, the most common side effects are nausea, vomiting, diarrhea, headaches, and sometimes vitamin B12 deficiency. If your kidney function decreases enough, metformin should be stopped. And metformin can lower your A1C by up to 2%. So if your starting A1C is, say, 10%, and you were started on metformin, once you were able to take the maximum dose, you could bring your A1C down to as low as 8%. Now, you may know that the recommended goal for A1C is below 7. So if metformin alone only brought your A1C down to 8, another medication would typically be added to help you get your A1C to goal. And the 2% decrease is what the medication at the maximum dose can do. And I'm sure you've all heard that increasing your activity and eating balanced meals 3 times a day can also help improve blood sugar. That would go the same. So if you increased your activity and 3 balanced meals and metformin at the maximum dose, you could decrease your A1C even more. So then I'm going to talk about sulfonylureas, and these have been around since the 80s. The generic names of sulfonylureas are glyburide, glipizide, and glimepiride. The brand names are in parentheses. The drugs in these classes work by telling the pancreas to release insulin, and these can be taken once or twice a day. The most common side effect of sulfonylureas are weight gain and low blood sugar. Because the medication is telling your pancreas to release insulin, you should not skip any meals. If you do, you'll have a greater likelihood of having a low blood sugar. And keep in mind, you take the medication, it's telling the pancreas release insulin, release insulin. So if you get busy and you forget a meal, that's where the low blood sugar is, because you have insulin out there looking for some carbs in your blood. Another caution is sulfur allergy. If you have a sulfur allergy, you may be allergic to this medication as well. An additional caution is sun exposure. When taking sulfonylureas, you can develop a sunburn even faster than you would normally, so it's important for that reason to always use a strong sunblock if you're taking this medication. And they have been found to be neutral for heart disease, which means they don't make it any better, but they don't make it worse. And sulfonylureas can lower your A1C by up to 2%. The next class of medications are the DPP4 inhibitors, the Dipeptidyl peptidase inhibitors. And the brand names include Januvia, Angliza, Tradjenta, and Nesina. The generic names are in parentheses. People with type 2 diabetes have too much of a hormone called DPP4 in the stomach. This medication helps decrease the amount of DPP4, which allows our pancreas to release more insulin when we eat. This medication will also help us feel fuller sooner, so we eat less. And because of how they work, DPP4 inhibitors have a low chance of causing a low blood sugar, and they don't cause weight gain. The most common side effects can be headache, sinus infection, and in some cases, disabling joint pain. And they can lower your A1C by up to 0.8%. Now we want to spend a minute talking about side effects, and this isn't just to diabetes medications, this is to any medication. If you think you're experiencing a possible side effect to a medication, it's recommended that you contact your doctor and let them know what you're experiencing. In a lot of cases, this could be a phone call, not necessarily a visit to the doctor. It's healthier for you to let your doctor know when this happens instead of waiting to the next appointment. And understand, no medication is meant for everyone. Currently, we have alternatives to most medications. So let's move on to SGLT2 inhibitors. Sodium glucose cotransporter 2. The brand names for this drug include Invokana, Farxiga, Jardiance, and Stigletro. The generic names are in parentheses. Now, in people without type 2 diabetes, when blood sugar becomes elevated, usually around 180 milligrams per deciliter, the kidneys will help lower blood sugar by excreting the sugar through the urine. With type 2 diabetes, this doesn't work as well. The body doesn't excrete extra sugar through the kidneys until the blood sugar is much more elevated, 220 or even higher. So what the SGLT2 inhibitor drugs do is it helps your body get rid of the extra glucose through the kidneys sooner. And this medication is only taken once a day. Now, some of the benefits of SGLT2 inhibitors are no low blood sugar, no weight gain, and maybe even weight loss. They may also help lower high blood pressure. Research has shown that Invokana, Farxiga, and Jardiance can reduce the risk of cardiovascular death, heart failure, and preserve long-term kidney function. Because these drugs cause more sugar to flow through the urine and bladder, that's where most of the side effects occur. You may experience bladder infections, increased urination, yeast infection, dehydration. So to prevent the dehydration, it's important to drink plenty of water if you're taking these medications. And these side effects can occur in both men and women, and diabetic ketoacidosis is rare. They can lower your blood sugar by up to 2%, and they can help lower your weight by up to 3 pounds. So onto the TZDs, or thiazolidinediones as they're often called. They include Actos and Avandia, and those are the brand names. These drugs help your body be more sensitive to insulin, and they can also decrease the amount of glucose released by your liver. It can take up to 12 weeks before you see the full benefit of these medications. Avandia is usually taken once a day, and Actos up to 3 times a day, and they can be taken with or without food. The most common side effects are headache, sinus infection, swelling, and fluid retention. And caution should be used if you have liver problems or congestive heart failure. And there's what they call a black box warning on these, which states that they may cause or worsen congestive heart failure. So weight gain and swelling should be monitored daily by the patient. And they can lower your A1C by up to 1%. The glucosidase inhibitor drug class includes brand name of Precos and Glycet. These drugs work by delaying carbohydrates from absorbing in the intestine, which help keep your blood sugar lower, because if it doesn't absorb, you don't have to worry about lowering it. Now, the glucosidase inhibitors are taken before meals, and they should be started at the lowest dose and increased every 4 to 8 weeks if necessary. Slowly increasing the dose will help decrease the stomach-related side effects. Weight gain and low blood sugar are the most common side effect. When you have a low blood sugar while taking one of these, you need to treat the episode with glucose tablets. Other types of treatments will not absorb in a fast enough manner. It's recommended that these be used cautiously in people with kidney or liver problems, and they can lower your A1C by up to 1%. The next drug class is meglitinides, and the brand names are Prandin and Starlex. These medications stimulate a rapid insulin burst, so it's important to take right before meals, so you take these up to 3 times a day. Side effects include low blood sugar and weight gain, and these can lower your A1C by up to 2%. So at this point, we have one dopamine receptor agonist, and it has uses for other than type 2 diabetes. But for type 2 diabetes, it resets the circadian rhythm to improve blood sugar control. Now, what are circadian rhythms? According to the National Institute of General Medical Sciences, circadian rhythms are physical, mental, and behavioral changes that follow roughly a 24-hour cycle, responding primarily to light and darkness in an organism's environment. And by resetting this, you somehow get improved blood sugar control. The exact mechanism behind why this lowers your blood sugar is unknown. It's recommended that you take it within 2 hours of waking up. Some of the possible side effects is nausea, headache, fatigue, low blood pressure, and fainting, and it can lower your A1C by up to 0.9%. The next medication goes by the name brand of Welchol. It's not known exactly how this medication works to lower blood sugar, but it's suspected of blocking sugar absorption in the intestine and also decreases cholesterol. 3 tablets in the morning and 3 tablets in the evening, and there's also a powder you can mix with fluid. The side effects are GI related, and it wouldn't be used if you have a history of bowel obstruction. It can also decrease the absorption of certain medications and vitamins, and it can lower your A1C by up to 0.5%. Now I'm going to talk about Rybelsus, and the active ingredient is semaglutide. It's a GLP-1RA, that's a tablet. The full name is glucagon-like peptide 1 receptor agonist, and it's an oral version of an injection called Ozempic, which I'll talk about that in a minute. People with type 2 diabetes don't get enough of a gut hormone called GLP-1, and what you do gets broken down very fast by another hormone called DPP-4. Rybelsus works by increasing the amount of GLP-1 in the gut, and it's designed not to be broken down by the DPP-4. And so it's going to work it's going to tell your pancreas to release insulin only when your blood sugar is elevated, and it's going to help you feel fuller sooner. It's something that you would start at 3 milligrams a day for a month, and after a month you could be increased to 7 milligrams a day, and that's where the blood sugar control would start. The 3 milligram dose is just to help your body get used to having extra of this hormone in your system. If you needed more blood sugar control after the 7 milligrams a day, the doctor could increase it to 14 milligrams a day. And this can also help with weight loss and decrease your A1C by up to 1%. So with GLP-1 receptor agonists, the most common side effects are nausea, vomiting, diarrhea, headaches. Like I said, the dose needs to be started at a low dose for a month and then increased. The cardiovascular benefits, at this point the FDA says Rybelsus may reduce the risk of heart disease. Specific contraindications with these medications, if you have a family history of MTC, which is medullary thyroid carcinoma, or MEN2, multiple endocrine neoplasia syndrome type 2, if you develop hoarseness in your throat, you would contact your provider, or if you felt any lumps, and if you have any vision changes, of course, you would notify your physician. Excuse me. So now let's talk about some injections that are not insulin that will improve blood sugar. So the first one that we're going to talk about is the injected GLP-1 receptor agonist. Now these are similar to Rybelsus, but these you would inject. And there's currently 6 on the market. You have Bydureon Besice, Trulicity, and Ozempic that you inject once a week, Victoza and Adalimumab that you inject every day, and then Byetta you would inject twice a day. And people with type 2 diabetes don't have enough of this hormone called GLP-1, and what we do have gets broken down very fast by the hormone DPP-4. This may sound familiar. GLP-1 receptor agonists work by increasing the amount of GLP-1 in the gut and prevents it from getting broken down. Therefore, the pancreas can release insulin when blood sugar is elevated, and it helps us feel fuller sooner. The most common side effect, again, nausea, vomiting, diarrhea, headaches. Some of them need to be started at a low dose to help the body get used to having more of the hormone around. And depending on which one you're on, you may need to adjust the dose to get more blood sugar benefit. As far as the cardiovascular benefits for these, Victoza, Trulicity, Ozempic has been shown to reduce the risk of heart disease. Bydureon, Byetta, and Adalimumab doesn't increase the risk of heart disease. Same contraindications, family history of MTC or MEN2, and contact your provider if hoarseness or throat lump develop. And if you're on Victoza, contraindication is for thyroid C-cell tumor, if that runs in your family. So another injection is Amylin or pramlintide, pre-filled pens. Now, Amylin is a manufactured amylin product, and amylin is kind of like a friend with insulin. They work together. And people with type 2 diabetes don't make enough amylin. So injecting Amylin before major meals can help improve blood sugar controls and replace what our body isn't making. So with more amylin, decreases the amount of sugar released from the liver. Our stomach slows down how fast it empties, which is going to prevent blood sugar from going high too fast. And it's also going to help us feel fuller sooner, so we eat less, and our blood sugar doesn't increase as much. So side effects are nausea, headaches, weight loss, temporary loss of appetite, and if you use this with insulin, adjust the dose of insulin to prevent low blood sugar. And it can decrease your A1C by up to 0.8%. So let's switch to insulins. Now, I want to point out that insulin's the most effective treatment we have to lower A1C percentage. There is no limit as to how much A1C can be lowered with insulin. Some of the insulins come in pre-filled pens, some are come in vials, and insulins are categorized with how fast they lower blood sugar. We have ultra-rapid, rapid, regular, intermediate, and long-acting. And dosing the insulin is very individualized and is always started at a low dose and increased over time to the effective dose for that person. And keep in mind, with oral medications, increasing physical activity and balanced meals are still part of the use of insulin. So I'm going to start with long-acting insulin, and those are called basal insulin. Then intermediate-acting, short-acting, rapid-acting are called bolus insulin, and then ultra-rapid-acting insulins. So with the basal or the long-acting insulin, we have Lantus U100, Basaglar U100, Toujeo U300, Levemir U100. These are usually injected once a day, but sometimes twice a day, and can last up to 24 hours. Tresiba or Degludec comes as U100 and U200, and they can last up to 48 hours. And the U100, U300, that's how concentrated the insulin is. It's like saying you got a prescription for penicillin. Well, is it 250 milligrams or 500 milligrams? With insulin, most of them are U100, but we do have some more concentrated ones on the market now. And these insulin help control fasting blood sugar and between meal blood sugar. And the most common side effects is low blood sugar and weight gain. There we go. So we're going to talk about intermediate acting insulin, and these control fasting blood sugar and between meal blood sugar, and one injection lasts about 12 hours, so they're usually injected twice a day. Now these are less expensive because they've been on the market so much longer. The most common side effects, low blood sugar and weight gain. So bolus or short acting insulin, and so these we would often use to help cover the carbs in a meal. And we have Novalinar U100, Humilinar U100, Humilinar U500, and that comes in vials as pens. And yes, that one is 5 times more concentrated than the U100. And these lower blood sugar after meals. And they're injected ideally 15 minutes before a meal, so up to 3 times a day. And the same side effects, low blood sugar and weight gain, are the most common ones. So rapid-acting insulins. We have Novolog, Apidra, Humalog, and Admelog. And these are injected 5, 10, maybe 15 minutes before meal, so up to 3 times a day. They last 4 to 5 hours per injection. They lower the blood sugars from the carbs that you ate. And the most common side effect, low blood sugar and weight gain. We also have ultra rapid acting insulin. And the big difference with these from the last ones I talked about is you only have to inject them 1 to 3 minutes before you eat, and they last for 3 to 5 hours. So they start faster and they're done faster, so that should decrease the chance of low blood sugar. Now, there's still a chance of, anytime you use insulin, there's a chance of low blood sugar and the possibility of weight gain. Now we have an ultra rapid acting insulin, and this one's inhaled, so this is a little different. They come in 4, 8, and 12 unit cartridges. So in these little cartridges is inhaled powder that is actually insulin. Because this is something you inhale, it absorbs very fast through the lining of the lungs, and your lung function should be assessed before starting a Afrezza. And you'd want to avoid any lung disease because of the risk of bronchospasm. And possible side effects are low blood sugar, throat irritation, and cough. And to prevent the cough, you can have a sip of water right before you inhale the Afrezza and right after you inhale the Afrezza, And the cough usually dissipates over time because your body is getting used to inhaling the powder. Across the board, all insulins are neutral with regards to their effect on heart disease, which would make sense because it's a naturally occurring hormone. Now, when it comes to injecting, insulin is absorbed the fastest in the abdomen, followed by the back of the arms, the thighs, and the buttocks. With the abdomens and the stomach, stay at least 2 inches away from your belly button or any scars that you may have already have when using the abdomen. With the thigh, at least 4 inches or about 1 hand's width above the knee and about 4 inches down from the top of the leg. The best area on the leg is the top and outer area of the thigh. Do not inject into the inner thigh because of the numbers of blood vessels and nerves in the area. With your arm, inject into the fatty tissue on the back of the arm between the shoulder and your elbow. And with your buttocks, inject into the hip or wallet area and not into the lower buttocks area. When injecting with an insulin pen, I recommend everyone to ask for the shortest and sharpest needle, because why would you do anything else? But you would inject it straight in and be sure to hold the pen in place for a few seconds to allow the insulin to completely leave the pen and get into your skin. And you never share insulin pens with anyone. Exercise that occurs immediately after you inject may speed up absorption. So you want to be careful if you're planning on strenuous activity after you're injecting. So if you're planning on playing tennis, you wouldn't inject into your racket arm. If you're planning to jog or run, you wouldn't inject into your thighs. So when rotating injection sites, you want to, you can rotate within one area and then go to a different area every week. And that way you're going to decrease the chance of building up scar tissue. If you inject into scar tissue, you don't get the full benefit of the insulin, and so that's why you want to prevent that from happening. Now, remembering to take medication is hard. For anything, it's hard. I get it. And some tips that I hope will help you. You can buy a week-long pill box, Or if you have different medications that you have to take 3 or 4 times a day, they have ones for the full week. You can also buy medication baggies and label those Monday, Tuesday, Wednesday. You can put apps on your phone to help you remember. They have medication apps. You can also just set an alarm. If you have to take something at 4 in the afternoon, set an alarm at 4 in the afternoon on your smartphone to help you remember. You can even put a Post-it note on the fridge, or put your medication by the coffee maker if you have coffee every morning. Some people have asked me about keeping medication in the bathroom. If you want to keep a dose or two in the medication, that's fine, but I wouldn't keep your whole bottle, because medications don't like excessive temperature and they don't like a lot of steam, and those two things can often happen in the bathroom. So if you want to keep a couple doses in there, and when it's empty, put a couple more, fine, but we don't want your medication going bad. So I want to take some time and answer your questions. Whatever questions you may have about anything I talked about. Okay, so here's a question. What do I have to get off of my medication for diabetes? Yes, I've heard this one before. So when it comes to managing type 2 diabetes, there's 3 things to help improve your blood sugar. 2 of them are in your control. Eating balanced meals 3 times a day and being more active. And unless your doctor said, no, don't exercise, being active can be as simple as walking after meals. And I want you to check with your doctor on this. But, being more active, eating balanced meals, not overdoing it on any one particular food group, and then remembering to take your medication. And most often, type 2 diabetes is tied to having more weight than what you want. And so by decreasing the weight, being more active, the balanced meals, the medication can help to the point where you don't need medication anymore. It's not fast. Type 2 diabetes doesn't develop overnight, so you need to have patience, but work with your provider. And like I said, being more active can be as simple as being walking after meals. For some people, it's chair exercises, so definitely talk to your provider about that. Okay, here's one. Heard a lot in the news about recalls on metformin. What's that all about? So I've heard this too. In December 2019, some manufacturers of the extended release metformin tested positive for a possible carcinogen. And we're exposed to this carcinogen every day. But if you're taking it day after day after day, then something needs to be done about it. Now, they've been testing regular release metformin, and that hasn't been tested positive. The ingredient is NDMA, and it's only been certain batches of the extended release metformin has tested positive. So, on one hand, the FDA is doing what they should be doing, looking for things like this. On the other hand, I know it's frustrating to find out that what you're taking needs to be changed. Okay, so here's one. It seems like my doctor is just picking a drug for me. Is there any reason why he's choosing that particular drug for me? Well, there's guidelines that are recommended as far as what your A1C is, where you were when you were diagnosed, to help doctors kind of go through the maze of all these different medications. And these guidelines are updated at least every year, sometimes more than once a year, depending on what research shows. So if you're not sure what why your doctor's choosing that drug or why that doctor thinks would be a benefit for you. I mean, obviously there's going to be blood sugar improvement is what's expected, but is there something else? Then ask your doctor. You're allowed to know these things. You're allowed to ask questions. And I know that's not the way it's always been, but that's the way it is now. And if you're still not sure after the doctor answers, ask your pharmacist. There's a good chance your pharmacist is going to be able to give you some insight as well. Any other questions out there? Well, I guess that's it for this evening. Here's information on our upcoming live events. March 15th, stop focusing on what you can't eat and learn about all you can eat. And if you want to attend more events, ask your coach. You could also ask your coach about text messages and tips about coaching on Facebook as well. Thank you for joining us today. We appreciate your attendance and participation.